Hi, good morning Greg. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 6th of August 2021. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Greg Cooper.
And what is your candidate number, please?
My candidate number is 2486312.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
All right. Can I see your ID, please?
Sure. Here it is.
Thank you. So let's start with warm-up questions. The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Why did you decide to be a nurse?
My family had a pervasive medical background. I had a grandfather and uncle that were doctors. Many aunts and cousins are nurses, and it seemed like a natural progression. I was always intrigued by the medical field, since I was a kid. Helping people in practical, yet compassionate ways, comes naturally to me.
What are your strengths and weaknesses?
My greatest strength comes from my ability to educate and empathize with patients. I can speak in their terms and help them understand what's going on with their bodies. I strive to enter into their shoes and treat them as people first, not just patients. My greatest weakness is overcommitting. I am so passionate about the job that I try and do too much at times. I need to slow down and trust my team.
What are your professional goals?
My professional goals are as follows: earn my MSN, join the Emergency Nurses Association, and become an emergency room nurse practitioner. I hope to mentor nurses and share what I have learned. I am excited about the opportunity to fulfill my goals. Last, I would like to advance into a management role as well, where I can oversee and train nurses.
How do you address questions from a patient's family and friends?
I lead with empathy. I know that I need to give them the best information that I can. However, I try to make sure that I'm answering them in kind ways, and I imagine myself in their shoes. Now, I know that I can't answer all of their questions, so I try to set boundaries and make sure I'm not enabling either.
How do you deal with cultural differences?
Nurses are well trained to handle cultural differences, but it takes experience and respect for others to do it well. As always, specific stories and methods are essential. You can tell of your success with this issue, or a time when you learned something valuable.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OET-speaking role play. Don't worry if I stop you when the time is up.
Hello, good morning Mihiraa. I am your attending nurse, Greg Cooper here.
Good morning, Greg.
Mihiraa, I am glad to inform you that you are ready for discharge now. And I am here to explain the discharge process to you. How you are feeling about this?
That's good to hear, Greg. I am feeling so much better now. And I can't wait to get back home.
That's great. Well, Mihiraa, I will explain the further procedures in the discharge process first.
Okay, you may please.
Initially, there will be a final check by the medical team to ensure your health status and to record them. Based on their observation, your discharge letter will be prepared by the doctor.
Okay.
Moreover, your post-discharge medications will be supplied from the pharmacy. By the way, may I know your understanding of the medications?
Actually, nurse, I know what medication I need to take, and when to take them. I have no doubts about it. But, I am worried about being able to remember to take it at the right time.
Mihiraa, your concern is understandable. In order to get the cure, it is important to take medication at the right time, all day, without any failure. It's okay, don't worry, I can help you with some suggestions, so that you will find it easier to remember to take the medication at the right time.
That will be of great help, nurse.
Let's discuss some of the strategies for managing medication. First suggestion is the use of a tablet organizer. A tablet organizer has different compartments, where medicines can be arranged. Use these individual slots to store medicines for morning, afternoon, evening and night, for a month. Therefore, you will not miss any medications.
That's cool. I will use a tablet organizer, nurse.
Good to hear that. Secondly, you can set a reminder on your phone, so that the alarm will be raised at the set time, thereby reminding you to take the medications correctly.
Yes, that is correct.
Mihiraa, you can also avail the support of your family members, who can help you in medication compliance. These are my recommendations, that you can make into practice, for assisting medication compliance. How does that sound?
Yes, nurse, these suggestions are very practical, and definitely I will try them.
Thank you for accepting my suggestions.
Well, nurse, I have a doubt.
Sure, you may please ask.
Well, my doubt is that, after the discharge, if I come across any pain, is it okay to take any pain relief medications, like paracetamol, as well as the medications provided by the hospital?
I appreciate your consciousness, Mihiraa. Perhaps, I am sorry to say that, I am not the authorized person to provide such information. Kindly speak to the doctor on duty about pain relief medications.
It's okay, nurse. I will talk to the doctor.
Thank you for your understanding. Mihiraa, besides that, I wish to provide some post-discharge management of your condition.
Okay.
Make sure to contact the hospital if your symptoms get worse. Alongside, checkups with GP is also highly recommended.
All right, nurse. I will do that.
Okay. And, do you have any other concerns, Mihiraa?
Yes, nurse. Actually, I am worried because the next time I go to see my GP, she won't know what treatment I have had here in the hospital. So, how can I explain it to her?
Your concern is quite understandable. Nevertheless, try not to worry about the communication of medical information. All your medical documents regarding hospitalization, treatments provided, and the details of medication will be transferred from the hospital to your GP. So, the next time you visit your GP, she will have all the necessary information about you.
That's perfect. It is very convenient, nurse.
Yes, exactly. Now Mihiraa, do I need to answer any other questions?
No, nurse. I don't have any other questions. And I hope I will be going home soon.
Definitely, you will be able to go home soon. Mihiraa, I hope I have cleared all your concerns. Thank you for listening to me. I wish you a speedy recovery.
Thank you. That is the end of your OET-speaking roleplay. All the very best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.